Well, hello and welcome to all of our viewers here today. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, today we're talking all about goldmidwifery.com, and we're going to have our conference coming up, and it's right around the corner. We've got our very special guest here today, Kim Morley. You'll be able to listen to her and many others at our Gold Midwifery conference. You can go to the website right now at goldmidwifery.com to look at the upcoming details of the conference, and we can't wait to see you all on the line there. Well, welcome to you, Kim. It's great to have you here at Gold Midwifery.
Thank you very much. I'm really pleased to be here. It's a real privilege to be able to talk to you, but to reach out to so many people through the Gold Midwifery Conference.
Absolutely. And Kim and I have been getting to know each other over the past few weeks. I have to say that, Kim, this is a topic that I had looked at years ago and felt like it didn't really have a voice. And I'm glad to say that there has been some, significant changes in this area. But before we get into the topic that you're talking about, why don't you go ahead and introduce yourself and tell folks a little bit where you are in the world and what you do for your work.
Okay, so obviously my name's Kim Morley, and I'm actually from the south of England. I live in the New Forest, so that's basically due south. And I'm actually employed for Hampshire Hospitals Foundation Trust. But my main work with women with epilepsy is at the Royal Hampshire County Hospital, Winchester. And I guess that's probably about 35 minutes from my home with no traffic. As you can appreciate, in the UK, it's often really busy. I do a women with epilepsy clinic on a Tuesday, also on a Monday once every fortnight, and the rest of the time I work as an epilepsy specialist nurse for neurology.
Wow. So you're really fully immersed really in this topic, Kim. Can you tell me, it seems like a niche area. It seems like would there be that many cases, but how did you first get involved with working with women with epilepsy during pregnancy?
I was actually doing a cross-country run, with my daughter. I was marshalling and I got speaking to a grandfather, and I knew his granddaughter has special needs. And also he started telling me about his daughter-in-law, who very sadly died from a condition called sudden unexpected death in epilepsy when his granddaughter was just 1 year old.
Oh, wow.
And I had young children myself at the time, and I really felt for him. So I went to our professional library, and I couldn't find anything about learning difficulties associated with anti-epileptic drugs, but I was doing some reading with the children in the library and came across a public book that had details of the Fetal Anticonvulsants Syndrome Association in Scotland. So I wrote to them and said, could you please tell me more about this? And they were absolutely fantastic. They sent me loads of photographs and all the research papers that had been done on the group. This is at the beginning of year 2000.
Right.
And then I wrote back and said, what can I do to help? And that was the start of my journey, actually learning more about epilepsy and women and anti-epileptic drugs right back then. So nearly 21 years ago.
Wow. Yeah, it's so interesting because even when you're talking through your story, which gave me goosebumps, by the way, because, we don't know why we meet the people that we do, but sometimes it transcends us into the direction that we end up in. But I was thinking about the fact that the conversation really started about the child that had been born.
Yes.
And I think that, with special needs. And so was that an outcome from the epilepsy? What was the case there, Kim?
So the mother was taking a drug called sodium valproate, and she was on very high doses of it. And after she'd had her baby, they hadn't been reduced. And she was so sedated, she had a seizure one night and didn't wake up after it, very sadly. Oh. And the valproate was actually, it was apparent, its effects were really toxic to the brain development. And I knew this child had considerable learning disability and some cranial facial abnormalities that reminded me of children that I'd come across when I worked in the outback of Australia who'd been exposed to alcohol. And so that's really what started my interest in it, trying to find out why this baby had been affected from the anti-epileptic drugs. And I think there's quite a bit of knowledge about major congenital malformations associated with drugs, but not about a syndrome. And at that stage, it was called fetal anticonvulsant syndrome. And there were a few key people who I know very well who were investigating the children from the group at the time. And the group was run by an amazing woman called Linda Hamilton. And I think she was really the first person who had exposed, as a mother, that her children all looked similar, but they didn't look like her or her husband. And so she put an advert in the paper and found out other families had children with similar craniofacial abnormalities.
Really?
Yeah. And they formed a group. And very sadly, her group isn't going anymore, but she was the start of my journey. Yeah.
Wow, that's really incredible. So this is really sort of in the last 20 years has grown, so tell me about the research. It sounds like there is some research happening. Where are we at today? Are we fully immersed in research? Are we getting the funding that's deserving of this particular area?
Well, if I just go back, there was research emerging, but like any research, especially when it's on one group, there's potentially bias there.
Right.
And so it didn't have a huge standing within the epilepsy world. And there is such a dilemma because valproate is probably the best drug for controlling generalized epilepsy, particularly juvenile myoclonic epilepsy. And then you've got the dilemma of trying to change somebody to something else that may not be as effective for them. But the research was getting underway, and my service gradually built up, and I became a prescriber and did my epilepsy module and then various modules for my masters.
Right.
And you learn more and more about people's journeys, but also about what's happening with the research. And I can honestly say it was not until really 2015 that everybody started to really start taking notice of what was coming out of the epilepsy registers, that valproate was standing out as being the most teratogenic drug out of all the anti-epileptic drugs. And the medicines, the MHRA, Medicines and Products Health Regulatory Authority, they got on board with it, and now every woman on valproate has to have an annual risk acknowledgement form and sign up to a pregnancy prevention program. And of course, in the last 2 years, the amount of research that's coming out has exploded in response to that. And also, just after Christmas then, we had the latest MHRA publication, and there's a patient information leaflet as well about the effect of all the anti-epileptic drugs. So it's complete transparency across the board, which is how it always should have been and how it always should be, that when you're making a decision about prescribing a drug and a woman taking it and her making that decision, she needs to know the potential effects in pregnancy.
Yeah, absolutely. Well, I mean, in some ways, this is kind of exciting because there has been this explosion. I know that you're going to be sharing some very special things and events that have been taking place as well during this actual presentation. And I just want to circle back and let everyone know that the title of Kim's presentation is Epilepsy in Pregnancy, Reducing Risks with a Multiprofessional Healthcare Team. So Kim, I'm very excited because there will be some new things that you'll be sharing at this particular presentation. And without giving anything away, of course, how excited are you about sharing some of these things? Because you've had to, even with us, you've had to be very tight-lipped and not share anything, right?
That's right, but all the publications are just out. So I've been able to make sure that the presentation that I'll be giving is totally up to date. And this is from Embrace UK with the latest statistics about maternal deaths associated with epilepsy, but also the MHRA information, so that it's bang up to date. And everyone then not only will have my presentation, but they'll be signposted to where they can gain all that information for people they care for with epilepsy in the future.
All right. Well, it sounds to me that this is a must-see presentation for really anyone working in the healthcare field with families, to stay really get the latest information on epilepsy. And you just don't know. I mean, you might think that you are not fully immersed like Kim in this area, but you don't know when a client's going to come through the door and present to you in this manner. So I think it's really important we get this information out and share it as far and wide as we possibly can, Kim. So thank you so much for being here and for sharing your great knowledge with us, and thank you for taking on this topic as your challenge in order to make sure that our families are safe. So do join us for our conference. We're going to be here at goldmidwifery.com. If you have comments or questions for Kim, of course, you can post them down below right now, and we'll definitely get those questions to her. Thank you so much to Kim Morley for being with us here today. It's been lovely chatting with you.
Thank you very much, and thanks so much for asking me.
And thank you, of course, to all of our viewers. Once again, we can't wait to see you online at goldmidwifery.com. But for now, we'll say bye-bye. Bye, everyone.
Bye.